Thank you for joining us for what I believe to be the most important forum that we've ever hosted in the history of our church. And that is tonight's topic, vetting the vaccine. It is no secret what has taken place in our community and in our country and in our world over the last 10 months, almost a year now, with COVID-19 being the dominant presence in the news and in our conversations. And so tonight, we're going to have an opportunity to hear firsthand expert information in an educational and dialogical forum about COVID-19 and about the vaccine. And so tonight, this is a special night because we have to make decisions. We have to make decisions about the vaccine. And the decisions that we make about the vaccine are going to impact our health and the health of our families and the health of our community. So thank you so much for joining. I hope you have a wonderful, informative experience tonight. So tonight is about education, about being informed, about being empowered. And so at this time, what I'm going to do, I'm going to introduce our guest. Before I introduce our guest, we did, when we sent out the information congregationally and we posted it in social media and on our websites, there are a couple of questions that we sent out that we'd like for you to take. Those questions are in the chat, or they're posted on the Facebook page, where you can ask these questions about your experience with COVID-19 and your openness to the vaccine. So we want you to address those questions. We want to come back and we're going to share what the comments have been in terms of the answers for those questions. We want to get a feel for who we're talking to and what your whole attitude is about both the vaccine and your experience about experience with COVID-19. So I am very excited and very happy to introduce our guest for tonight. So first, let me begin locally. We have with us tonight one of our community's premier medical professionals and physicians in the person of Dr. Nelson Adams, who is a native of Miami, Florida. He is also a graduate of the great Howard University. Howard's doing great things these days. And in addition to being a graduate of Howard University, he is also a graduate of Meharry Medical College, and he completed his 4-year residency in obstetrics and gynecology at Emory University, and is currently a board certified obstetrician gynecologist here in our Miami community, has been here for years, practicing, serving. Not only is he a obstetrician gynecologist, but he's just known as Dr. Adams. People know him as a trusted medical professional in our community. His experience is great. He's served in so many different places in our community. He's currently the chief of staff at the Jackson Medical Center North, and is the founder of Metro Miami OBGYN and Associates. And so Dr. Adams is also a minister of the gospel who's earned his Master of Divinity degree from New Orleans Theological Seminary. And so Dr. Adams, thank you for joining us tonight, and God bless you.
Thank you so much, Pastor. So glad to be with you. I look forward to the conversation.
Thank you so much. We also have with us tonight Dr. Ovita Fuller, who is an associate professor in microbiology and immunology at the medical school at the University of Michigan. She is a part of the faculty in the STEM Initiative of African American Studies, and she is also an adjunct professor at Payne Theological Seminary and is an ordained itinerant elder and a former pastor of an AME church, African Methodist Episcopal Church. And joining us tonight is her one of her seminary classes, Health Matters. And so her class has joined us tonight. Just to tell you a little bit about Dr. Fuller, she has earned her bachelor's degree in biology and her PhD in microbiology and immunology from the University of North Carolina at Chapel Hill, and completed her postdoctoral research in virology at the University of Chicago. She also recently served on the FDA advisory panel that voted on the vaccine in December. And so she has been on the front line in terms of the process of approving and moving this vaccine into the public space. And so we're very happy to have her with us tonight. So Dr. Fuller, we're glad to have you tonight. God bless you.
Thank you for the invitation. I'm really pleased to be able to share with you tonight.
Great. And so we're going to ask Dr. Fuller to share with us first. And I'm going to tell you what this presentation, the first part of our time together is going to be, is a presentation from Dr. Fuller, who's going to give us an expert, detailed presentation on the disease and on the vaccine. In order for us to make an informed decision about the vaccine, it's going to be important for us to understand something about the disease itself. And so it's going to be for the next 20 minutes, and I want everyone to hang in here because we can't educate thoroughly and about the vaccine unless we take the time to give you some background information that's important in order for you to make the decision. So at this time, I'm going to turn the mic over to Dr. Fuller for her to begin her presentation.
All right, thank you, Pastor Lomax, and to Dr. Nelson and to all the people on the line. I'm grateful that we could meet on this occasion to take a look at what we need to know about the COVID vaccines. And in order to do that, it's important, as was mentioned, that you also understand the disease. So what I'm going to do is give you a short, hopefully short, but thorough introduction into what COVID is, what the virus is, and then the vaccines. And so I'm going to now share my screen. By the way, are we doing the opening poll or was that already done?
We have done the opening poll. So I'm going to ask, we have some results from that. If you have not done the poll, we want you to go ahead and do the poll so we can collect the data. But Minister Benita, can you just tell us what the results are thus far from the poll?
Yes, sir. According to our poll, there are, according to the poll, question 1, has anyone in your house or immediate family tested positive? There are 2 yeses, 5 no's. Question 2, if given the opportunity over the next 2 weeks, would you take a COVID vaccine? 2 answered yes, 4 answered no, 1 answered unsure.
Okay, great, thank you. All right, so I'm going to go ahead and share my screen and we will get going. And I trust you can see that. Let's make it large. Yes, you can see this?
Yes.
All right, so we're talking tonight about vetting the vaccine, and I do appreciate the invitation from Fountain Church and the fact that they're hosting this. The takeaway message, in case you have to step away or whatever, I want to give you the take home before the end, and that is for COVID-19 vaccine, each person must make an informed decision. There are unknowns about the current messenger RNA vaccines, but at the 95% effectiveness in preventing COVID disease that was presented to the FDA panel, even for a little while, we don't know how long the protection lasts, a COVID-19 vaccine is a helpful place to start. But you have to make the decision and you have to be informed, and that's what we're trying to do tonight. You also need to make and implement an infection prevention plan for this 2021 winter season. We're in a perfect storm of holidays, of coming in from the winter, of students being home, and of travel, that this virus, as you can see, has already taken off to a huge second phase. I have listed here also some helpful resources that you can go back and look at later because I'll go through a lot of this fairly quickly tonight. These are pictures of the virus. This is a coronavirus. You see this often with CDC This is an actual electron micrograph of what the virus looks like with the large spikes on the outside. So the family of viruses that COVID-19 virus is part of is the coronavirus family. And I'm not going to go through this, but I just want you to know the official name of the virus, which was initially called the novel coronavirus, is now SARS coronavirus 2. It came from a natural origin. It's a zoonotic virus, meaning that these viruses are common in animals, over 100 different coronaviruses in different animals. And when humans come in contact with the reservoir, the natural host, that sometimes gets into humans, adapts to humans, so it's able to transmit from person to person. This is called a zoonotic transfer. We've seen it before with SARS, we've seen it with MERS, we've seen it with West Nile virus. We've also seen it with the avian flu that goes from, or swine flu that goes from animals to humans. The disease is called COVID-19 or coronavirus infectious disease 2019 for when it was discovered. And it is, or emerged, was declared a world pandemic on March 11th, less than a year ago. Another thing I want you to get here is that you want to go back to your biology classes where our genetic material is DNA. That is put in cells, is made to messenger RNA, which is a code that makes the protein. So this coronavirus family is made of messenger RNA as their genetic material. We'll come back to that later. Just to show you where we are now from March 11th, 2020, when this was declared a pandemic around the world, the US is the leading country with the most infections. And here you see our curve of infection of cases. And as of January 15th, we had 241,000 new cases per day, around that number. And so the peak is here. There's a typo there. Look at that. So new cases here, whereas our previous high had been around 47,000 in mid-July. And so you see what has happened with this winter wave coming from Halloween and all those holidays and travel and coming inside. One of the things that I want to make clear is that with this great amount of cases in the US, that it is disproportionately affecting people of color. And these are the stats for African Americans from May 2020. On the left is the number of people in the population that are African American in Florida, Illinois, or Louisiana. And on the right is the number of, and these are three examples, we have others, of people who died who were African Americans, percentage of people who died who were African Americans from COVID. So you see in Louisiana early on, 32% of the population, but 70% of the deaths from COVID-19. And in Illinois and in Florida, you weren't exempt, even though it wasn't as high. If we were to put Latinos and others here, it would be even higher. In Chicago, just to look at across the ethnicities, Latinx, Asian, here's the Black Americans, and this is deaths across those same ethnicities. This looks at the age distribution early on, where the gold bars show that infection could be found in all ages, but that severe illness and deaths, and this is the red shows you deaths, happen disproportionately to the older over 60. And now we know since May that these red the red bars would even go down lower because all ages are susceptible to severe COVID and death. So what contributes to these? We won't have time to talk about these tonight, but I just want you to know there are a number of factors, many of them emulating from the legacy of enslavement in this country, from socioeconomics to medical care to the misinformation that we often cling to or hold on to. So tonight we're trying to give you accurate information. And then we ask the question, what can we do about these kinds of disparities? They are unacceptable. How does SARS spread? Part 2. This is a highly infectious virus. It is made in cells. All viruses are parasites. They have to be made inside cells because they cannot they don't have the factories to make more of themselves, and yet they have to produce progeny. So these are cells producing virus. The cell would be bigger than my screen. These are all viruses, the little blue dots coming from one area of the cell. So these are aerosol transmitted. They're respiratory viruses. When you sneeze or cough or talk or sing, they go into the air. And so respiratory viruses can be easily transmitted. They enter into the upper and lower respiratory tract when we breathe in the aerosols from somebody else who's been infected. This is why being at least 6 feet away from another person while you're talking or talking with them, and even better, having mask on the person talking and mask on the person listening will stop this transmission of viruses. It happens in all of these ways, and also by touching items like rails or metal, that a person who has touched those aerosols then touches their own face and transmits it into the respiratory tract, where it travels down the windpipe into the lungs and reproduces in the cells of the lungs, and particularly the alveoli, the very small lung where oxygen is exchanged. I want to take a minute and just show you how contagious COVID is. It's more contagious than flu. It's more contagious than the common cold virus. This is an early example where one person coming from Singapore went to a ski resort in France and shared a home, a chalet, with 12 other people for just a weekend. Out of that, 21 people ended up being infected in 4 different countries. And this has been traced to this one person who was asymptomatically traveling and went on vacation, shared the air in a home, or the people in that home shared the air with him, and ended up with 21 people infected, highly infectious. But you can imagine that if the virus is being made at these high levels in any one cell, that someone who's putting out virus is putting out a lot of virus in the aerosols they breathe. This is another example in Lansing when this bar reopened in June. This is a frequent place of students. Over 120 young adults tested positive after this bar had been open about a week, who had all were traced to this bar. This also shows you that it's transmitted by aerosols. This is a restaurant in a region of China where the air conditioning flow goes from across these tables, but not tables D, E, and F. Person A1 was asymptomatic when they went to dinner with his family. Family B and family C also ended up with people who were then subsequently diagnosed with COVID after about 10 days, showing that it was the air vent that probably carried this, because these people did not get infected or anybody else in the restaurant. So do not gather. Restaurants indoors are great places for this virus to transmit, because it's transmitting in the air that we breathe, even when we talk. The timeline of this, from the initial time of exposure, there can be up to 14 days before symptoms show up. And actually, symptoms may never show up. There are about 40% of the cases of infection that are not asymptomatic, no symptoms whatsoever, but they are still shedding virus and able to transfer that to other people. Other people become symptomatic with mild, moderate, or severe illness, but this usually happens, the symptoms show up around 5 or 6 days. But the unfortunate thing for COVID, for us, is that COVID is being shed even before the symptoms occur. Remember the guy at the ski resort. We can shed the virus before we know we're infected. And so this is the quarantine period, because these symptoms can show up anytime from the time of exposure through 10 to 14 days. All right, what happens with the disease? One can get mild, moderate, or severe. Severe is typically hospitalized or at least seen in a clinic. These are the common symptoms: dry cough, shortness of breath, fever, headache, muscle pain, tiredness, purple toes. I'm sure that Dr. Adams can talk a little bit more about this later. Loss of taste or smell is very common, even for people that don't get other symptoms. And people may not get all of these, just one of these, a range of illness. It is the battle between our natural host defenses. We're wonderfully and fearfully made to get rid of foreign items, and the virus replication that leads to inflammation, cell damage, and excess mucus. About 80% of people will have mild or moderate or no symptoms, but they can transmit the virus, whereas 20% will have severe illness and may die from COVID. When someone speaks, the virus is inhaled, it goes into the back of the throat, may result in a dry cough, and then it replicates, traveling down into the lungs, into the bronchi. This is what a healthy lung looks like. this is what a lung with COVID looks like, or some other pneumonia. And so this is the small branches of the lungs. Down here, this area is blown up. And what happens is a healthy lung has air passages that allow oxygen and CO2 to be exchanged to go to the other body organs, whereas a lung that has been infected with COVID-19 virus has swelling and mucus clogging due to virus replication in these tissues, due to the immune response, such that you end up with clogged alveoli that cannot get air in, oxygen in, or CO2 out. And so you end up with fluid building up and people cannot breathe. I'm told it feels like you have an elephant sitting on your chest. More importantly, or as importantly, besides being able to breathe, it actually affects every organ in the body, because we all need oxygen in order to fuel different tissues of the body. So it not only affects the lungs, but has a wide range of body effects, from brain strokes and blood clots to lung clots and heart arrhythmias and heart attacks, to kidney failure, to immune impairment, to vomiting and diarrhea, to blood clotting and bruises, and even to mild things such as loss of smell or pink eye. The more severe cases are handled at the medical facility by giving a person external oxygen or putting them on a ventilator. And the kind of support will determine whether a person will live or die if they have severe COVID. Even if you have mild COVID, there's something called the long hauler syndrome, where people continue to have symptoms months and weeks after they have initially been exposed to COVID. So brain fog, shortness of breath, hypertension, joint pain, insomnia. All of these are part of the disease, which we don't always know. We don't know a lot about. There are many unknowns with COVID and coronavirus pathogenesis. So this is an experiment that we're all in, that we didn't ask to be in, but we're all in it. How do we navigate this season? We have to make a plan. Remain home, do not gather, do not travel. And that's what happened over the holidays, which is why we're in such a high level now. Always use the 3 W's: wear your mask, wash your hands, watch your distance. Avoid crowds, confined space, and close contact. And then if you're exposed or think you're exposed, get a test and trace contact, be cooperative. And then with these vaccines, which is what we're coming to now, with or without the vaccine, you still have to use these preventions of washing your hands and covering your mouth to prevent getting that virus into your system. There's a way to use masks that's correct. Both people need to use masks, both the person who is shedding virus and the uninfected person. They both need to distance, and better yet, just stay home. And so these are the best ways to avoid risk. The higher risk is with no mask, or if the asymptomatic person is without a mask. Wear the mask correctly. And you can come back and look at this, but it has to be close on the sides. It has to cover the mouth and nose, and you have to keep it on. And there are different kinds of masks. So now let's move into the vaccine part. What do we need to do to mitigate this COVID-19? We have to do all the public health preventions, but now we have research coming on board that has led to vaccines. And so these are references that you can look at. This is a great one about the technology behind the messenger RNA vaccines. So what is the COVID-19 vaccine? Vaccines are given before one gets infected to boost the immune system. So they prime the immune system. They do not cause disease. We have lots of great vaccines: yellow fever, smallpox, polio, measles, mumps, rubella that every child gets, chickenpox, pneumococcus, human papillomavirus, rabies. And now we have 2 COVID-19 emergency use viruses. There are different kinds of viruses. The one that we're using for these 2 vaccines is a subunit vaccine. In other words, it's not the whole virus, it's just a part. So if my hand were the virus, were the COVID-19 virus or the coronavirus, if we did some kinds of vaccines, we put in a weakened form of the virus. But with the subunit vaccine, we're only putting in a portion, and that's my thumb. Only the thumb is going into persons, or the messenger RNA, to make the thumb, not the whole virus, just the thumb. We've also had to look at these for their efficacy, which is their effectiveness, and for their safety. And that's true for all vaccines. That is how we determine if they are working or not. Features of vaccines: we have to know how to store them, what the immune response is, how to distribute them. We want high uptake because if we don't get high uptake, we will never get the protection in the community that can protect people who cannot get the vaccine, called herd immunity. This shows you some pictures. These are actually electron pictures of the whole coronavirus. You see the crown, the spike, and it's this spike protein, this projection that we're putting the messenger RNA in to the cell in order to produce the protein, just that protein for the immune response to make, to be primed to. So when you see the real virus, it prevents the disease. Here's what happened in the clinical trials. These vaccines have not skipped any steps. They've gone through a very regimented preclinical to phase 3 study, which has to happen now because of past injustices with clinical research. And so we have all these numbers of different reagents that are in the clinical research trial for COVID. We have 11 that have reached the large scale, over 3,000 people, typically for 5 years, phase 3. And we have 2 that have passed the FDA approval for an emergency use authorization. These are Pfizer and Moderna. So now these vaccines did not skip any steps. They were approved quicker because of the cooperation of researchers, and because instead of having 3,000 people for 5 years, we had to have 30,000 people for a shorter amount of time so we could get the same power of analysis. And so they went through the FDA process and received the emergency use authorization. We have others, as you see here, that are in the pipeline, that are in phase 3 studies. The data has not yet come before the FDA or the FDA advisory panel. Probably the next 2 will be Johnson & Johnson and AstraZeneca, but these 2 have been approved. Here's a great video to watch to look at what happened with those viruses and those vaccines. Okay, so we're almost at the end. What's in a COVID-19 messenger RNA vaccine? What is going into the person's arm who gets the vaccine? There's not the virus, there's just the little piece of genetic material that's encoding that spike, that thumb I told you about. And it's inside of a fat lipid called a lipid nanoparticle. And that's what's in the vial. That's reconstituted with water, sucrose, and then it's put into your arm. There are no preservatives, no antibiotics, no adjuvants, which help boost the immune system. And so what happens when it gets into your bloodstream and then gets to our own cells, our cells take up this lipid fat, which has the RNA of the spike protein that's made on our own factories for proteins, our own ribosomes, into viral spike proteins that go on the cell surface, our own cell surface. So not the virus, just the spike attachment protein. And then our immune system, that wonderfully made immune system, sees cells that have that spike, that foreign spike on it, and they mount an immune response that includes both ends of the immune system. So that's what we're doing when we get this immunization. We're teaching the body to respond to the spike protein such that when it sees the real virus that has a spike protein, it knows what to do. And I just want to take a minute to tell you what we did with the EUA, or what was done with emergency use authorization, how these clinical trials happen. They're double blind, meaning that neither the researcher nor the person knows whether they get the placebo or the vaccine. There was a large number of people that were divided into vaccine and placebo groups. They got their first injection, like those who take a vaccine will, and the second boost 21 or 28 days later. Blood samples were collected, and people self-reported if they had symptoms. If they had symptoms, they were tested and confirmed for infection. Samples were taken until there were over 200 cases registered within at least 2 months or more. That data was unblinded and analyzed. And here's what we mean when we say this is 95% effective. Out of the 200 cases in these 42 or 30,000 people in the 2 studies, 180 of the cases were people who did not get the vaccine. Only 20 cases of COVID with symptoms was in the group that got the vaccine. So that then lets you say that this vaccine is 94 to 95% effective against COVID disease symptoms. Doesn't say anything about infection or shedding, but against disease protection. So it protects against the ability to get disease. All right, these are the symptoms. We already talked about these. Importantly, COVID vaccines prevent disease symptoms, illness, and death. We do not know if they prevent infection or shedding. So if you and when you get the vaccine, you still have to mask, distance, and not gather, so not to spread the virus to somebody else because you may be shedding. The bottom line is these vaccines, both Pfizer and Moderna, prime our immune system with that spike protein such that we get different kinds of immune response, including memory cells, that when we see the real virus, that we have a memory defense system that can counter it. And in order to have high uptake, which is necessary, we have to build trust. And that's what we're trying to do tonight with transparency, with trusted messengers like Dr. Nelson or Dr. Adams and myself, community engagement. This is all required so people will understand that they can make an informed choice. The last couple slides just give you details of the vaccines. These are the recommendations for the various phases. Healthcare personnel and long-term health facility residents were first. The states are adjusting these categories, so they're not hard and fast, but this will tell you what they originally were set by the CDC. We are also looking at similarities between the vaccines. They're both coronavirus spike proteins. They're both messenger RNA. They both work on infection or shedding, or both work on disease, but we don't know what they do with infection and shedding. We know that preventions are necessary. We know that both require 2 injections to get up to that 95%. And when you get the vaccine, you will be given a card and an address that lets you register in the CDC's register. So we know you've been vaccinated and you can report any adverse events or get any communication if something comes up with these vaccines. So this is the vaccine adverse events reporting system that's run by CDC. And every person who gets a vaccine will actually need to connect to this system. These are the numbers to do that so that you can enroll yourself. Differences in the 2 vaccines are really minor. The main one is that for Pfizer, the second boost, which gets you up to the 95%, is in 21 days. With Moderna, it's in 28 days. The other major difference is the storage requirement. Pfizer requires very low temperature, minus 70 degrees or minus 94 degrees Fahrenheit. Pfizer or Moderna is freezer, like your home freezer, minus 20. And the Moderna can last for 30 days. Once it's reconstituted, the Pfizer can only last for 5 days and still remain active. Thus, we're going to find that Pfizer will likely be in large hospitals that have this minus 70 capacity, and Moderna will likely be in pharmacies and clinics and other places to meet the public. Also, the Moderna one comes in smaller doses, whereas the packaging for Pfizer is in large doses. So you need to know this when you are allowed to get a vaccine, where to go. The last thing I want to cover is the side effects. And this is very important. I believe that if you know what to expect, then you don't panic when you see those things. So here's what we know from both the trials and the rollout to date. The common side effects, they're mild to moderate that most people see that lasts up to 2 days, not usually over 3 days, is pain and swelling in the site of injection in the arm. Over 80% of people, fatigue, just being really tired, headache, muscle pains, chills, joint pains, and fever in a least order here. Everybody doesn't get all of these. Some people have no symptoms. Some people feel pretty bad for a couple of days, but it goes away. More adverse events, 1 in about every 100,000 that have been reported, including at the time of the vaccination, flushing, swellness, shorting of breath, nausea, vomiting, pleuritis in a few people. And you've heard of this anaphylactic response, this allergic response that as of 12/20 was 6 cases. But as more people get the vaccine, we'll expect to hear more about these. So here's the address that if you have any adverse reactions or serious reactions that either you or your health professional or your family needs to report. So this you should come back and take a good look at. So in summary, for COVID-19 vaccines, you must make an informed decision. Nobody can tell you what to do. You need to know your medical condition, your level of exposure, and your access to other people who may be carrying the virus. And you decide. It's important, however, that if we're ever going to get up to the place where the COVID vaccines are effective as one tool in our toolkit, that we have high uptake. You also must make and implement a prevention plan, whether you take the vaccine or not. And for me, I think it's probably a good idea to do so. I'll explain that in the question and answer. And then here are some helpful resources that you can go back to. We know the risk of COVID-19, and they are not good. If you get COVID-19, it can be very serious. We are learning the risk of the vaccines. They're not over the risk of the disease, but trust and verify, get accurate information and weigh your situation. Even if you use the vaccine, you have to practice the things that we've talked about. So that's the end of what I wanted to say. We need to continue the conversations. We need to talk to each other. We need to make sure that you advocate with your health provider to talk about your situation. For me, I work from home and I'm in good health. So I did not get the vaccine back at the beginning of January when it was offered to me as a medical school faculty, but I have signed up to get it near the end of January, just because I wanted people who needed it most, who were more exposed, to get it. I have said that if my 96-year-old mother who lives in North Carolina were alive, she passed in May, that if she were given the opportunity, I would drive her to the clinic as fast as we could get there. So it depends on your situation. I'm going to stop here and ask that the closing poll is done, and then we'll go from there. I hope this has been very helpful for you.
Thank you very much, Dr. Fuller. And the closing poll questions will be placed in the chat, and we're going to ask everyone to please respond to the closing poll. So while you're doing that, I'm going to ask Dr. Nelson Adams if he would join us and share with us, take a few moments to share with us from a medical professional here in our community what he's seeing, what he's hearing, and what's important for us to hear from his perspective. Dr. Adams.
Thank you so much, Pastor Lomax. And let me salute Dr. Fuller for an excellent presentation. You covered nuts to bolts, and suffice it to say, when you've got your health, you've got just about everything. Unless you have been seriously ill or in a coma or are not from planet Earth, you already know much about this pandemic. You know that some folk have few symptoms and some folk die. You know that folk of color seem to be impacted in a disparate way. You know that everybody's health is their health. You can't compare where you are, who you are, what your situation is with another's. And so much of this, in my opinion, is about perspective. I think one of the things that Dr. Fuller just said that certainly resonates with me is the whole notion of trust but verify. Much of what I've seen as a practicing physician, and suffice to say, I've been doing this for 42 years. I'm not only a clinician, but I'm president of the medical staff of a fairly large hospital here. I'm chairman of the board at Meharry Medical College, and Dr. Shildreth, I'm sure, Dr. Fuller, you are very much familiar with, as he too sat on that committee, that FDA committee. I chair the board of a managed care company here in South Florida, and I'm a past president of the National Medical Association. I say all that just to say that I have many perspectives. I'm a father. I live at home with one of my children and my wife, and I'm the only one who goes out. I'm a OBGYN. I've had about 15 of my patients who I've had to care for, pregnant women who were positive. Fortunately, none of them became seriously ill. All of them have done okay. My partner contracted COVID, ended up with pneumonia, and was out of work for 5 weeks. Thank God I have not been impacted with testing positive, and have received both doses of the Pfizer vaccine with no untoward effects. I say all that simply to say that we are dealing with a real precarious situation, and one that has to be viewed number one, based on accurate information. And the notion of trusted messengers is something that needs to be emphasized. I will say that I have a long history with Tuskegee. I have a sister who lives there. My mother attended Tuskegee. My father went to Tuskegee. And these are folk who were there during the time of the syphilis study. I knew several people who had been a part of that and who ended up with tertiary syphilis. So I'm very familiar with that and understand the concern that many have as it relates to folk of color being used in an inappropriate way as it relates to the healthcare arena. Suffice it to say that the science is real, number one, and number two, that the science has been not only confirmed, but affirmed by folk who look like us. The Dr. Fullers of the world, the Dr. Hildreths of the world, and many others who have taken a deep dive to be sure and very sure that every I has been dotted and every T has been crossed, puts me in my comfort zone. I'm a clinician. I'm not a researcher. I don't take the deep dive, but I do rely on folk who do. So I simply say for those who have a pushback mindset as it relates to whether or not the science is adequate, I think you can put that to rest. Second thing I'd like to say is that the rollout of both testing and vaccination has been troubling, particularly in the African-American community, and for a variety of reasons. Much of it deals with our health, and many of you on this call certainly are aware of the social determinants of health. So it's not just your physical health, but those other things that impact that, where you live, where you work, the conditions in which you have to work, your living environment, whether or not you're in a place that's multi-generational and one bathroom. All of these things are factors that will impact how you have to weigh this whole issue of dealing with the coronavirus. And so the perspectives that I ask that you at least tee up in your thinking is, one, the personal, how might it impact me as an individual? And then the public health piece, others. And once we do that, I think we have a much better opportunity to at least, number one, be well informed, and then to take action that is in the best interest of not only you, but your family and the broader community. I certainly would be remiss if I did not say that much work still needs to be done in terms of communicating accurate information. Many of you listen to talk radio, and you perhaps hear as much negative about whether or not to be tested, whether or not to certainly to be vaccinated, as opposed to those of us who are promoting that. And I simply ask that you take time to do the due diligence for yourself. It's extremely important that you do that you indeed trust, but verify. I am concerned primarily at this point that the good news of the benefit of the vaccine has fallen on fertile ground. However, many of the folk who are desirous to get the vaccine can't log in. They can't get registered on a website. And that makes them frustrated, and it makes those who were sort of on the bench say, well, you see, I told you so. Many people are challenging me frequently to say, fine, you need to be talking to folk, trying to let them know that they need to get the vaccine, et cetera, et cetera. Well, the problem that I'm having is that I can't get shots in the arm of folk who want to get it done. And so I'm not beating that drum perhaps as loud as I would like to. And there may be someone on this call even who is saying, I'm sort of undecided and I'm concerned about you, but I think you're going to come along because, you know, it's been said that success has many parents and failure is an orphan. You know, so if we are successful, if those of us like me who get vaccinated and do okay, if we get to a point where many of the trusted folk that you have in your sphere of influence get vaccinated, then you will more likely come along. I'll say this to make a point. About 50% of the workers at the hospital where I'm chief of staff, only about 50% have been vaccinated. It was offered to everybody. So even healthcare workers who've kind of seen this up close have some trepidation. And so I certainly understand why you might as well. Most of them are not so much afraid of the vaccine itself, but they have two concerns that are teed up. One is we don't know how long it's going to last. And obviously the second is we really don't know if there's going to be any adverse effect. Suffice it to say that with most medications, we don't know the whole story, whether or not it's going to have an adverse effect. And if you read what could happen if you take Tylenol or aspirin, you'd probably never take one. The science is what the science is, and adverse reactions can occur. But the opportunity to be vaccinated with this particular vaccine that provides 95% protection for you, at least, from getting seriously ill. Doesn't mean you won't harbor the virus. It doesn't mean that you won't harbor the virus and be able to pass it on to somebody else. But it does mean that you can protect yourself. And by protecting yourself, if you continue to do those things that are not personal, but for the public good, that is wearing your mask, keeping your distance, washing your hands, then I think we have a real opportunity of turning the corner. Some have suggested that we've not seen the worst yet, that the death toll may end up at 500,000 by the beginning of March. It's likely that those of you who are under 65 won't be offered the vaccine for quite some time yet, another month or two, and maybe not even until the summer. And so it's extremely important that our perspective be one of the glass half full and not half empty. And if and when you can be vaccinated, I simply encourage that. Again, I'm a clinician. I'm not the scientist that takes the deep dive that Dr. Fuller has. I'm a clinician. I'm an ABC 1, 2, 3 kind of guy. And for me, it has to be real plain. I do a radio show called Health Talk. The mantra there is when you've got your health, you've got just about everything. I think we simply need to do all we can to stay healthy, not just for ourselves, but for the broader community as well. I'll stop there, Pastor, and be happy to entertain questions that might come up that might be appropriate for somebody who's on the front line.
Okay, great. Thank you so much, Dr. Adams. And being in a virtual environment, it impedes us from being able to show our appreciation in an audible way and clapping hands or making some noise. But you guys have done just an extraordinary job in explaining both the virus, the vaccine, and the importance of us making positive considerations towards being vaccinated. But to our audience tonight, first of all, I want to thank everybody for taking the poll. And I think the first entry poll was, did you know anybody who has contracted COVID? And I think that was maybe in the context of your family. And would you, if you had the opportunity, would you take the vaccine? And I think the answers to that was, initially, it was, and Minister Benita, you can correct me on this, 6 yes and 20 no's for each of those questions respectively. 6 yes, we know someone who's contracted the virus. 20 no's, I would not take the vaccine. And so, secondly, the exit questions are, after hearing the presentation, would you take the vaccine? And was this presentation helpful for you? So we're going to come back and give the results of that later. But the reason Dr. Fuller, thank you so much. And Dr. Adams are here. Thank you so much, Dr. Adams. They're here for you. They're here for you tonight. That's why they came, because you heard the presentations, you heard the perspective from the community, but you may have a question. And so if you have a question, we want to make sure that we address that question tonight. So you can put that question in the chat portion on the Facebook page. Minister Benita, try to capture as many as you can and drop them in our chat also. But we do have a couple of questions, and I think this question was addressed in a couple of times, that if you take the vaccine, and you guys can clarify this for us, if you take the vaccine does not prevent you from contracting the virus or passing on the virus. So that was a question that was asked, and just want to make sure we're clear on that. So I just lobbed that up, which I think both of you addressed it, but somebody want to just clarify that for our audience, please.
Dr. Nelson, Dr. Adams,
Sure.
I'm sorry, Dr. Adams.
Sure. Listen, you can call me anything but Miss.
Okay.
Yes, indeed, your mucous membranes, your nasal passages, your oral pharynx can harbor the virus even after getting vaccinated. What we know about the vaccine is that it prevents serious, severe disease. But the reality of it is that you may still be able to pass the virus on to others. At least that is what we think at this point. It has not been proved otherwise at this point. Second thing about the vaccine is that we don't know how long you have protection at this point. We don't know whether it's going to be months or years. We don't know whether or not these two injections, with the first two that have come out, these messenger RNA vaccines, the Pfizer and the Moderna, if it's just going to be those two, or if that's going to require, as you know, with some vaccines, that requires a booster even later on. So there are lots of things that we don't know. But the bottom line is this: yes, you can still pass the virus to others, and so it's extremely important that all of those public health measures that we've been talking about, the mask wearing, the social distancing, and washing those hands are still extremely important.
Just to add very briefly, the other good thing about getting the vaccine is that one of the problems is that our hospitals and clinics are overwhelmed with people who are sick with COVID, such that even if you have something else right now, my mother didn't have COVID. She had diabetes, end-stage kidney disease, but it's hard to get in because you now have so many COVID patients that have to be addressed. And even if you do, we couldn't go see her. So my point is that even just preventing disease and serious illness for that person, but also for society, is a real plus of the vaccines in terms of getting us out of this COVID pandemic and getting us back to a state where our medical systems work better. So even if it doesn't block infection, and we even know that people who get natural COVID are shedding virus for months, meaning that they're still making virus to shed it. So the vaccine seems to at least stop the serious disease, even though you will still have to wear mask and distance, so you're not taking it to somebody else in case you do get infected.
Okay, excellent. Here's another question that we have from our audience: Is there anything on the way to help with with transmission?
Not that I know of. There are studies being done to ask if the people who've been vaccinated, and by the way, vaccination with the mRNA vaccines seemingly gives a much stronger protection than natural infection. And that's probably because it's very specific to that spike protein versus having immune response to the whole virus, where some of it is not protective. So yes, we know that the vaccine does provide better protection. How long it lasts, we don't know. Will there need to be boosters? We don't know. And we hope that the studies to look at the shedding is in progress. Studies to look at other things, I'm not aware of them at the moment. I don't know if Dr. Adams has idea of other things that are out there.
I do not. I would like to, in a similar vein, share that many people have been commenting about the new strains, if you will, of the virus and whether or not the vaccine is going to be effective there. Consensus at this point, as I understand it, and Dr. Fuller, please weigh in on this, but consensus is that the vaccine, because of, as you just said, it's focusing on that spike protein, is likely to be effective with these new strains too. The time will tell. What has been said about them is that they may be more infective. And if that is the case, then this whole issue of once again, the distancing, hand washing, and these public health measures has to stay on the forefront of our preventive measures. So
yes,
we got a lot going on.
So yes, so the current variant, the more contagious one, is thought to be covered by the messenger RNA vaccines. And that's because that vaccine covers a region that all of the viruses so far still conserve. But let me just say, the fact that the virus keeps replicating, every time it replicates, it gets an opportunity to change. And so in order to stop the threat, we need to stop the virus from spreading from person to person. And the vaccine can help that. But even more importantly, people, believe it or not, the preventions we already had, which we have not used very well in the USA, are the best way to stop spread. Staying home if you don't have to go out, masking when you do have to go out, staying your distance, washing your hands. These are even more powerful than the vaccine for not only stopping disease, but stopping spread as well, which stops the ability of the virus to replicate to make more mutants. So this vaccine seems to cover the current mutants that we have, although they're going to be spreading really fast. We're going into another bump up because this mutation has happened and it's now in the US. So buckle your seatbelts, but definitely do those preventions or we may never get out of this, or it'll be a long time. I'm not going to say never, but if people don't do better, we're going to be stuck here for a long time.
That's saying that we have to do our part, and that's all of us. So there's no exceptions. All of us
no exceptions.
Have to take heed to this. Here's another question. If I have respiratory issues already, are there any issues with the vaccination? If I already have some pre-existing respiratory issues?
To my clinical colleague, please.
No, in fact, you need to be trying to get to the front of the line. That's a pre-existing piece. If you got a respiratory problem already, and this virus is going to impact that same area, then you are somebody who is really at high risk. So the answer is no, and you certainly do need to be vaccinated if that opportunity presents itself.
The only people who are not recommended to get a vaccine are those who have known allergies to vaccines. So if you get a flu vaccine or some other kind of vaccine and you have a anaphylactic or some other reaction, then you need to talk to your healthcare provider. Even if you have other allergies, talk to your healthcare provider and make a plan for when you go. Now, most sites are requiring that people that have known underlying allergy issues or issues are there for at least 15 to 30 minutes at the vaccine site to make sure they're okay before they leave. But you should be making this decision and knowing what to take with you to the vaccine site. Respiratory illness, as I said, is a great reason that's a risk that puts you at a higher priority for getting the vaccines.
Excellent. Brothers and sisters, if you have a question, I want to encourage you to make sure you ask the question. We won't be here much longer, but it's not going to be often that you're going to have access to this type of expert information, persons whose expertise is at the very top of the food chain. They're the best in the business. And so if you have a question, please don't lose this opportunity tonight to make sure that any question that you have regarding either the disease or the vaccine, that you take advantage of this time to ask it tonight. Do have one question here. Can you be reinfected with COVID-19 multiple times?
What we think is that, yes, you can be reinfected. We don't know how long natural immunity or the vaccine protection lasts. We're seeing that there are cases where people have gotten reinfection and they've gotten disease, but that is not the most usual thing. We won't know until we know as we go along with the vaccine and people get re-exposed. One of the things I was about to bring up that concerns me, Dr. Adams said that science is real. Well, science is only as real as far as it has gone. And you mentioned that we don't know the long-term effects. We have to make sure that the researchers have to make sure that people are being followed in the studies which are still ongoing, to know when the immunity begins to fall off. Because if I think I'm protected, particularly as a clinician, and I'm not, and I may be, and that's why the mask and the other preventions are so important, then I may be getting exposed and subjecting myself to still getting disease at some point down the road. Is that 6 months? Is that 2 years? Is that 3 years? We don't know, but we need to be doing those studies to find out. We all need to know that. But meanwhile, in the now, we know it does protect you at least 3 to 4 months based on the people that have been in the clinical studies. Probably longer than that, but I think the last I saw was that the natural immunity is known to go out at least 6 months for most people.
Okay. Awesome.
You know, I'd also like to add that, you know, it's been said, many of you have heard this before, that when America gets a cold, Black America gets pneumonia. I say that simply to say how important it is for you to be as healthy as you can possibly be. The stronger you are, the less likely any disease, COVID or otherwise, is going to impact you in a negative or permanent way. And so for those of us who are not eating right, who are not drinking enough water, who are not getting exercise, whose stress has caused them to do things that they wouldn't normally do, now is the time, and the time is always now, for you to pay attention to your health. When you've got your health, you've got just about everything. You know, I'd like to say that as it relates to health, there are at least 3 A's that I tee up sometimes. It needs to be available, and, you know, doing the things we talked about are clearly available. It needs to be affordable, and, you know, the testing is still for the most part free, and the vaccine is free. And it needs to be accessible. Now that's where we're having lots of problems now. Access, and even the places that are doing the vaccines, many of the folk who really need it don't have the transportation. They can't take off from work. They don't have time to be logged in trying to register. So we've got lots of issues. And those of you who are part of your sphere of influence or policymakers and folk who work at the state level, please, ma'am, please, sir, let's continue to encourage folk to make sure that those of us who are in that least of these groups have representation. A lot of folk just don't know what to do. They're in a pickle. They're trying to do the best they can, but the situation, the social determinants of health, and the system, if you will, has made it very, very, very difficult. And we really have to be our brother's keepers. And I think that's why Pastor Lomax and the Fountain is doing this, to keep us informed and understand how important it is that it's not about some of us, but all of us. Lottie-dottie, and everybody's got to play their part in trying to make us a healthier community.
Pastor Lomax, if I could just make a closing statement, let me just say, this is not your typical vaccine. This is not your measles, mumps, rubella. This is not your chickenpox vaccine that we know and we trust. So when we say it's safe and effective, we're not talking about that we know for 20 years from now it's going to protect you and you'll never have to have a boost. This is an experiment. Why do I say that? COVID-19 itself is an experiment. It's not an experiment any scientist put us in. It's an experiment nature put us in. So any way you cut the cake, you're in an experiment, whether it's with the disease and the virus, or whether it's with the vaccine, which is the lesser of the two. We don't know a lot about the long-term effect of this vaccine, but for now, we're in an experiment. And as I've had some people say, put it this way, the train has left the station. I wanted these vaccines to go out more slowly and to continue in the phase 3 a little bit longer with increasing the number of people in phase 3, but that's not what was decided. So now we have them, they've been released, and we as our physician said, we don't want to be left standing on the platform when the train has left. We don't want to look up in June and find that most African Americans or people of color did not get the vaccine. So now even our numbers are higher because we're still susceptible to disease and death because we did not get the uptake of the vaccine when we had the opportunity. I don't want to be left standing on the platform when the train is rumbling down the track. So I encourage people to do your diligence, get the information, weigh your situation, but unless there's some reason not to, it seems to me that the best of the two options, COVID or the vaccine, is to at least use the vaccine for what we know happens now, that it protects against disease and symptoms. And what we don't know, we'll find out as the experiment on all of us proceeds. We do not, as people of color, want to be left standing on the platform.
Okay. Very well. Thank you so much, Dr. Fuller. I don't see any more questions. I want to thank both of our presenters tonight, Dr. Nelson Adams and Dr. Ovita Fuller. My appreciation is immense. I can't express adequately how thankful I am that both of you would agree to join us tonight to speak to the South Florida community, particularly the minority community, about our options and informing us about both the vaccine and the vaccination. I want to also just appreciate each of you for your professionalism and for what you have accomplished professionally. We're proud of you, and we appreciate you for the hard work that you have put in to prepare yourself and then what you're bringing to the table, not just to minority communities around the country, but around the world. And we're grateful for that. To our South Florida community, I think let's see, let me just make sure before we go. Okay, here's the last survey. It was about, has this been helpful to you? And I think, if I'm reading this correctly, that 10 are saying, yes, it's been very helpful. And then we have, would you take the vaccine after having heard this presentation? And Minister Benita, you can correct me if I'm interpreting this incorrectly, that we have 3 no's after hearing the presentation. And so, is that correct?
If you could give the percentage, that would help, of the total. Is it in percentages as well as actual numbers?
No, it is not.
Okay, all right, that's fine then.
Okay. Okay. Well, we are grateful that this has been very helpful. We want to also tell everyone to be very prayerful. Both of our presenters are also ministers of the gospel, and so they're people of prayer, and so we want to encourage you to be very prayerful. So thank each of you for joining us tonight, and we will be present again as we bring these community forums to you, trying to help our community with everything that's relevant to helping us be healthy, safe, and also prosperous. So with that being said, feel free to join us at the Fountain Church each Sunday morning at 9:45 a.m. for our online streaming service. Our children's service follows that. Immediately following that at 11:45, and our teens are at 11 o'clock. Also to the Payne Theological School, the class that's with us tonight, thank you so much for your presence, and we wish you the best in your theological pursuits. And to the Fountain Church, thank you for giving us the opportunity to serve our community. God bless each of you, and have a wonderful night.
Thank you. Good night.
Good night. Thank you, Pastor.
Thank you.
Good night.
Stay healthy out there.
Thank you.